everyone. Welcome to the Veterinary Business Podcast, your place for inspiration, guidance, and real stories from veterinary medicine. I am Narain, the founder of this podcast and one of your co hosts. Today, I have an exciting guest for you and Esteban. And the topic we are going to be covering today is how can a global veterinary perspective drive efficiency, profitability, and humanity in your practice management. So this is going to be a fun topic. How can global veterinary perspective drive efficiency, profitability, and humanity in your practice management? I'm going to jump into the questions I have for Esteban. The very first question is, tell us a little bit about you, your journey, so that people who are listening to this podcast and who don't know who you are get to know you a little bit.
Okay, so first of all, thank you so much for the invitation over here. I'm actually Esteban Satomayor. I'm the third generation involved in the veterinary field. My grandfather was the founder of one of the first veterinary colleges in Ecuador, South America. My dad is also a veterinarian who established the first 24-hour hospital in Ecuador back in 1999. I have a BA in marketing, a BA in business administration, and an MBA from the University of New Orleans. I'm currently also the CEO of Vetflex, a company that sells and distributes veterinary equipment all over Latin America. And that's a little bit about me.
Thank you. Let's jump right into this. Profitability is a challenge for many hospitals, right? I'm sure you work with all kinds of hospitals all over the world. And what are the most common management mistakes you see? And what kind of advice do you have for potential practice owners?
I think there's the biggest thing that I have seen pretty much all over the Americas. That is what I've been consulting, is that we don't pay attention a little bit to benchmarks. And how benchmarks can help us to figure out where are we struggling or where are weaknesses. For example, it's pretty common for me to go to clinics and suddenly see that they are not producing enough chemistry, like a chemistry analyzer or exams or blood exams. They're not doing enough. So if we see the benchmark between the number of examinations that they're seeing per day and the labs and the lab that they're doing, they're not the same. Like we should have a lot more. So like the average will be about 30% of our pets that we see per day should need at least blood test. And we go to the benchmarks and we don't see that. And that's probably one of the first things that I try to figure it out is how are they doing with the blood test images. Because that's one of the first and easiest ways to increase revenue in any hospital.
Absolutely. You have worked with practices small and large and across the Americas. Are there any lessons from Latin America that you think would benefit American practices?
I think there are. I think there are a lot. First of all, we need to talk about the difference of how the veterinary medicine is developed in different countries. In all the Latin America side, we don't have veterinary technicians, or it's really uncommon to see veterinary technicians. There's actually some countries that they don't even have the technical or like the third degree level as a technician. So they're basically people that help. So the veterinarians are actually the ones who are doing pretty much the entire work, all the operational side, all the lab testing, all the blood drawing, all the images. They're the one doing it. Because on Latin America, the difference is that it may take 4 to 5 years for them to become a veterinarian, instead of the States that is going to be 8 to 10 years for them to become a veterinarian. So there's a big difference. There's also a big difference on the number of colleges that we have. So for example, in Brazil, it's a country of 150 million people, and you're going to have over 600 veterinary schools. In Ecuador, we're 17 million people in the country, and we have 26 veterinary schools. And then in the States, you're a country of 350 million people, and you have about 33. So we have a lot of people, a lot of veterinarians at disposable to work for us. So it changes a little bit the model. Of course, it also means that we're going to have a much more competitive market here. So, for example, in the radius that I'm here, like in my hospital, probably a mile away, I might have at least 5 to 6 veterinary hospitals of 24 hours. So we need to start finding different ways and different competitive advantages. And one of those competitive advantages is the experience. What type of experience are you actually giving to pet owners and pets? So yeah, I think one of the things that we can learn from in the States is that we need to be a lot more efficient on the way that we share that experience to our client. How are we making that experience of the pet owners different than the other clinics? What are we offering in the human touch, in the human relation, that it's going to be different, that it's going to help us connect more with that pet owner?
Yeah, I'm a little confused. Like you said, in both examples you gave us, Ecuador and Brazil, you said because it's only 4 years, there are literally, 10 times more, people who are veterinarians, as opposed to in America, there is less veterinarians, on a per capita basis, but then you make it up with veterinary technicians and other support staff. So I'm trying to understand. I know then you talked about the experience, the customer experience. Of course, if you have 10 times more veterinarians, you can provide a better experience in those countries. Here you don't. So I guess I'm trying to figure out like how does this come about? Like how does it like manifest, in let's say in the US, where you don't have as many veterinarians as you have in the countries like Brazil and Ecuador.
And that's a little bit of how we can control the volume and try to get that balance between having a really good experience with their clients and increasing more volume of patients that we see. How are we working with our retention and our retention rate to try to have that experience and provide that experience? Probably it's not just going to be the veterinarian in the States, but it's going to be our receptionist. It's going to be our CSRs. It's going to be our technicians. It's going to be our doctors. Are we taking care of our pet owners too? Are we actually answering all the questions that they have, giving them enough time for them to create that bond between our team? So it's also, yeah, we have veterinarians who are doing that job, but are we paying enough attention in the States for our receptionists, our CSR, our technicians to be answering those questions, helping enough, developing communications to create that bond with the pet owner?
I think I started to understand what you're saying. You're saying because there's less veterinarians here per capita versus in those countries, now you're a receptionist, now you're vet tech, now you're, your extended team has to fill in those shoes. So are they getting the right training? Are they being measured properly? Are they being, as opposed to you hire somebody off the street and she's working for you, but she doesn't represent you the way you would represent yourself because she doesn't have the training and the knowledge and the experience to do that adequately. So what that means is the quality of care or the experience comes down.
Completely. I think you nail it to the point, Aaron, is the issue that we have. It's like if we're seeing so many patients and we're so busy here in the States that we
Mhm.
start to lose a little bit that human touch. It's like we starting to get into that age of AI technology and everything that everything has to be automatized, and we're losing that human touch.
Yeah, I mean, it's kind of crazy. I think how many veterinarians are there in the US? 30,000?
Yeah, I think it should be about 30,000. It's for me the best way to call it. It's like how many vet schools you have. It's in comparison to
Yeah.
other
And
countries.
there are 393 million pets, right? That means one veterinarian is taking care of, it's crazy. Is it like, you know, 393 million divided by 30,000? How much is that? 93,000 divided by 30.
You could be better at that math, but it's
Yeah, so it's coming to 13,000 pets per veterinarian. That's like a crazy ratio, right? I mean, like you can't take care of 13,000 pets as a single veterinarian. So you really need to have a machine, a team that's capable of taking care of 13,000 pets per veterinarian, right? And I think you're saying that focus is not there. That mindset is not there to like really scale up your team to be able to take care of 13,000 pets.
Exactly. We're just focusing in, yeah, we need to be more effective to like see as many patients as we can per day. But
Right.
also there's a big issue here that we're always talking about, that it's like prices are increasing so much for medicine and for all the medical care that we need to give to our pets, that just customers and pet owners are starting to slow down on the business that they're making per year.
Hmm.
So the ones who are going there, they can choose where to go because
Right.
they're willing to pay more. So what type of experience are we providing to those clients that are willing to pay more? Are we giving them 15-minute appointments? Are we giving them 10 minutes appointments? How can we differentiate ourselves? How is our clinic? How does our clinic also look? How when was the last time that we renovated our facility? Do we care about that? Do we don't care about that? In Latin America, you really need to pay attention to those type of things because they're going to have a new veterinary hospital that is going to look much better, that's going to have better service, customer service. In the States, we haven't got to that point, but we might because we're slowing down.
Right. Let's talk about artificial intelligence and digital tools that are reshaping the industry. How do you see these technologies helping veterinarians and practice owners optimize time and resources without losing the human touch?
I think that's one of the hardest things that we're going to have right now with technology. It's losing the human touch. Yeah, if you right now you're able to talk with ChatGPT basically as they talk to you basically like as a human, and we're losing that. It's going to be much easier for us to ask questions directly to ChatGPT than just go ahead and ask another pal, another friend that who's an expert on that field. We can have the knowledge of just talking to somebody easier. I think that's one of the issues that we need to start figuring it out is, okay, in medicine, if we're going to start to automatize all the communication with our client, if we're going to do all the recalling, all the appointment sets, if everything's going to be automatic, are we losing that human touch or not? So I think that in the future, a competitive advantage will be the ones that are actually having those type of communications directly with a person, with a real person instead of a machine.
Absolutely, absolutely. Um, let me. This is my last question for you. But before I get into my last question, can you give us any examples of AI or digital tools that are successfully being used? For what purposes in the setting in a veterinary practice setting?
Oh, there's a lot of tools. There's many tools. I don't want to name specific brands, but what I
Right.
can tell you that right now there's so many tools that you can develop pretty much all the appointments for you. I really like what we can do right now with marketing. So, for example, I use a lot of video generation softwares that they can actually, you can record yourself for a few minutes talking, and then the software will create all the videos as if you were talking directly to the screen. They can correct the eye. So, for example, you can have a prompt, and you can be talking to the computer with a prompt, and the video can and the software can correct your eyes, so you can see, or like the bit like the software will correct your eyes, so it's like if you will be seen at the camera directly, and then it just cuts down so much time of recording and everything. So in the sense of marketing, it's a huge tool. So you can record your doctors probably making a 5-minute video, and afterwards you can put the prompt that you want them to say, and like the video will be generated directly. So just to how we can cut down on marketing tools. I think those are one of the softwares that we're not talking about on AI. Then we have, of course, diagnostic softwares that are going to be doing all the diagnostics in the future for imaging, for lab, for so many things that we're going to be seeing in the future, especially just outside the customer experience of like communication as a whole.
That makes sense. Let me go to the last question I have for you. If you had to give one practical piece of advice to a clinic owner who wants to modernize, improve his practice without losing the essence of that patient experience, the pet owner experience, what would it be?
One is hearing your client. Hear your client, what your client and the pet owners are asking. How's like if are you actually doing any type of interview? Are you actually doing any type of survey to the pet owners that are coming to your practice to see what they want, what they need? I think that's one of the golden nuggets that I can give to everybody is have you ever surveyed or are you like currently surveying your customers frequently enough to know what they're looking for and what changes you need to make to improve that service and experience that they're having in your hospital or clinic.
Thank you so much, Esteban, for joining us today. I want to take a moment to not only thank you, Mr. Esteban, but also thank our listeners. Without you, we won't have this podcast, we won't have this community, and obviously all the guests and experts who participate with us, who help us share knowledge and information to our community. If you're a practice owner, definitely tell your friend. And we have a gift for you. Many of the concerns practice owners have and what keeps them up at night is not attracting the right kind of clients, what we call the ICP, ideal client profile. So we have a complimentary marketing strategy meeting for you. It's veterinarybusinessinstitute.com/MSM for marketing strategy meeting. Go to that link. Uh, you know, we will spend 6 hours studying you, your competition, telling you what you're doing right, telling you what you could do differently. Even Mr. Esteban talked about benchmarking. So you will know how you are doing against your competition. You can benchmark yourself. That's our gift to you for being part of the community. Once again, the link is veterinarybusinessinstitute.com/MSM. Till we meet again, keep leading with compassion and making life better for your patients and pet parents. Enjoy your week.